A full abdominoplasty is the most common abdominoplasty performed. I know all the different types of abdominoplasty can get confusing, but a full abdominoplasty generally refers to a typical conventional abdominoplasty or tummy tuck. The components of a full abdominoplasty are the hip to hip incision, so the lower abdominal incision. We position that, or I like to position it so it's hidden behind your bikini. So I have you bring your bikini or underwear or lingerie, whatever you want to bring, that is the style you like to wear on the day of surgery, and we will mark you so that your final scar falls behind that garment. What makes it a full tummy tuck is that we lift up all your abdominal skin all the way up to your breastbone, and we treat the extra abdominal skin both above and below your belly button. So if you have loose skin above your belly button, you need a full tummy tuck. If you have no loose skin above your belly button, then you probably only need a mini tummy tuck. But let's get back to a full tummy tuck. So the full tummy tuck, we make that incision that's planned before surgery, so the final scar will be as hidden as possible. Lift up the skin and fat on the front of your tummy. Tighten up the muscle underneath. Your belly button stays attached to your abdominal wall, meaning your belly button has a stalk like a tree trunk, and we leave that attached to the muscle layer underneath, and that's how your belly button stays alive. We tighten up the muscles while the skin and fat layer of your belly is lifted up, and then we pull that skin and fat layer down, cut out the extra skin and fat, and sew you up. Finally, to make your final belly button, it's still your belly button. It's still in the same place it always was. But once we pull that skin and fat down to get it tight, we feel underneath where your belly button is, and we'll make a new little hole on top to deliver that belly button out. So you'll have a final scar around your new belly button, a little circle scar around the new belly button. I should say new. It's still the same belly button you've always had. It's just coming out through new skin. So it's the same belly button you've always had. It's in the same place on your body it's always been. It's just coming out through the skin that was pulled over the top of it as part of the tummy tuck. So the belly button comes out through the skin that is now sitting on top of it, and we sew that together. We sew the lower incision together once we cut out the extra skin, and that basically makes up a full tummy tuck. We transpose the umbilicus is what the technical name of that is, meaning we left it attached to the muscle layer and transposed it through the skin that was laying on top of it after we tightened everything up. So that is a full tummy tuck. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page, and our SpeakPipe is located there. Thanks for listening.